For this short video, I'm going to introduce the chapter for theories and models and go over just a couple things for you so you can be prepared for class, as well as what to kind of look for in this chapter. As the chapter, there's a lot of different theories and models, and we certainly can't cover all of them, so this will help you in what to focus on a little bit more. So I'm going to go over to the slides here that are actually on Moodle. So remember to take a look at these and read the chapter 7. There's also the short quiz that will follow. So before I get into theories, just a reminder that a major goal of health education and health promotion involves changing behavior. So behavior change really occurs from two main ways, and that's through learning or through maturation, or just somebody maturing. So a 10-year-old isn't necessarily going to exercise or eat healthy because they want to reduce their risk for heart disease, where a 50 or 60-year-old is very likely going to exercise or eat healthy because of risk for heart disease. Because of just maturing and age, the reason that they're going to do certain behaviors is just because of maturing. The other way is learning. So we can teach children in a different way about why to exercise, and maybe not, we can talk about heart disease, but it would be in a little bit different way. So when theories and models will help us think about our participants, where they're at, and how they view the problem, so that we can design better interventions for them. So a theory really provides a basis for understanding certain situations or events, as well as helps health educators, health promotion specialists better understand what overall influences health and the health of our priority population in particular. So a fully developed theory should explain the major factors that influence the event or situation of interest. It also should explain the relationship between these different factors and the conditions where the relationships do or do not occur. And as you go through more of the theories in the chapter, and as I continue, you'll see more about these factors, relationships, and conditions. So by definition, and in your textbook, a theory really is a systematic way of understanding events, behaviors, and or situations. We want to use theory-based approaches to designing interventions and programs. They provide direction and justification for the program. So these are different than the planning programs or the planning models that we looked at earlier this semester. Planning models are about, the planning, implementing, and evaluating of the whole program. They're program planning models, where these are helping provide that justification more for the actual interventions and how we're going to get our participants to participate in healthy behavior change. So it also helps determine why people behave the way they do and how to change their behavior, as well as helping us consider other influences on behavior, such as social and physical environments. So theory-based approaches are really important to have and to consider into the development of your program, but then also just interventions that you will do in the future through your internship or future job as well. So behavior change models are generalized hypothetical descriptions used to analyze or explain something. Models draw on theories, but they're just not as specific. So models tend to be based on a number of theories to help understand a specific problem, setting, or setting. But in health promotion, oftentimes the terms of theory and models are used interchangeably. And so, having theory-based approach would also involve the use of models. So those are used interchangeably in that sense. So the relationship between some, concepts and constructs and theories, and how we actually use these ideas for use in interventions are kind of in this visual here. So theories are the big picture, and again, models are, along with that. So theories or model are that big picture, and constructs are come next. So concepts actually are building blocks, are the primary elements that are involved with theories, and then constructs are a little bit bigger than concepts, And that's when the concepts have actually been adopted for use for that specific theory. So when you're reading about the different theories, you're going to see constructs, different elements that are really, make that theory or model different than the others. And when we do design programs, you may use multiple theories or models or draw on ideas and constructs from different theories and models. And then ultimately, then we can operationalize these ideas and constructs and variables for use in the actual interventions. So behavior change theories really help explain how behavior change takes place. So this ecological perspective is one that we are going to talk about more in class, along with the ones that are following in these slides. So I'm not going to go over each of these now. These are for you to kind of look through, read over, and then be prepared to participate in some activities in class. I will also go over them more. But also, there are a lot of theories and models in this chapter, so ones to focus on are particularly in this video here and are in these slides. So just to kind of go through them quickly here so you know what you're looking for, but look through these slides. Then we're going to touch on interpersonal level theories, particularly the social cognitive theory, so you can pull out that one to look on. And we're also going to talk about the theory of planned behavior. That one is not on the slides, but you may see it in your quiz. Then for intrapersonal theories, this is where we're going to spend a lot of time in particular in class going through the health belief model and the trans-theoretical model, or stages of change. So definitely read through these. I've used them a lot in real life and in jobs and creating surveys and creating interventions. And so these have been really helpful to me. And so we'll spend some time on these. So there's some slides here that will help you with those. I will go over these again in class, but good to kind of preview them. We'll also look at a couple community level theories, the community readiness model and the diffusion of innovation theory. Community readiness is very similar to the stages of change. It's just for at the community level. And then take a look at the diffusion of innovation theory here. When we go to actually apply the theory to practice, it's good to have a basic grasp of theories and models. Again, you may pull from ideas or constructs from different ones in your design. And so having a good understanding, just a basic grasp of these is going to be really good for you before you go out into your internship and into the field of health education and health promotion. You also want to just make sure the theory or model is applicable to the goals of your program. And so that's where, we just always want to go back to the goal and mission with that. I guess I did skip over this limitation as I'm going back. They're not always adequate for all settings or programs, and it can be difficult to transfer these theories from the academics to the setting to the real world. So I'm hoping that some of the activities that we do in class will kind of help you apply these to how it might look in the real world, but know that sometimes they are a little bit more difficult to transfer over. But we will talk about them more in class. So I just, again, go through these slides a little bit more, focus on these theories and models particularly, and ones that might show up in your quiz, but these are the ones we'll focus on most. So I hope this was a little bit helpful in what to look at and pull out in this chapter, because there's a lot in there, and help with your quiz and being prepared for Tuesday's class. So if you have any questions, please reach out. Otherwise, I will see you soon in class. Thank you.